Good afternoon and welcome to the Empowering Family Caregivers video show. We're here with you live. It's 2 p.m. on Friday, June 24th, and I'm very pleased to announce that the subject of this show will be about actually two important organizations based right here in New York City. The first organization is the New York City Family Caregiver Coalition. And the second organization we're going to be talking about, which is very relevant to, both are very relevant to caregivers in that they offer services for caregivers. The second organization is SNAP. And we have two distinguished guests, the first of which is Marie Ellen Galasso, who is the Director of Social Services for SNAP. And she has the dual role of being the co-chair of the New York City Family Caregiver Coalition. So you've got two big responsibilities on your hands. And Megan Eisenberg is the Director of Caregiver Programs at SNAP. And why don't we start with, welcome to you both. Thank you for coming.
Thank you. Good to be here.
Marie Ellen, why don't you tell us a little bit about both SNAP and New York City Family Caregiver Coalition.
Sure, I'd love to. Well, SNAP is a community-based agency in Queens, and we provide a variety of services for seniors. And SNAP is a part of the New York City Family Caregiver Coalition, which is how I got involved. And the coalition is really a variety of organizations that have come together to look at caregiving issues in New York City and to support caregivers and organizations that are working with caregivers.
Right. And now the New York City Family Caregiver Coalition is part of the national?
Yes. What basically happened was Pfizer went to the National Alliance of Caregiving and gave them funds to do coalitions throughout the whole United States. And so NAC, National Alliance for Caregiving, came to Council of Senior Centers and Services, which is an agency basically that supports aging services in New York. And then they got Emblem Health involved and hosted us, and we got organizations together to discuss the issues of caregiving, especially as they pertain to New Yorkers, because we know that New York is diverse and
we're a big market too.
Yes.
Well, Marie Ellen, I want to ask you now about the New York City Family Caregiver Coalition in specific, and then we'll go and talk about the caregiving program at SNAP. Tell us about the mission a little bit, and the history and
Sure.
the background of New York City,
Sure.
and how, also how does the organization of associations and not-for-profits really, at the end of the day, help the caregiver, him or herself?
Right, okay. Well, the coalition, as I said, is made up of a number of organizations. So just to give you an idea, it's medical organizations, community-based organizations, faith-based organizations, government. And we really came around a table to say, okay, how can we help caregivers in New York City be supported so that they can do this role, because caregiving is a major issue.
Right.
And in doing that, when we first met, my goodness, we were talking about our mission, and we really wanted to be sensitive to diversity and realize if you're identifying as a caregiver and there's many different backgrounds involved,
Sure.
You really want to be able to talk about how will you meet the needs of such a diverse population and make sure that
when you mention diversity, you're talking about ethnic as well as
definition of family.
Yeah.
New York has many different families. It's
Right.
not just the traditional family.
Yeah.
And so there was a lot of conversation about that. And on the table, what we're really talking about is advocacy, even in terms of policy, education, and public awareness and information, so that people will be able to even realize, oh, I fall in that category, and there is help out there. So we have a directory of organizations that are involved in caregiving in some way. We have events and educational venues that just inform people.
And I want to reiterate that point, because I think a lot of family caregivers, you're probably not aware of all the resources out there that are available to you. There are organizations like SNAP, but there are coalitions for caregivers throughout the country where you can find a listing of services and organizations that come under that umbrella that can offer you information specific to your needs.
That's right. That's exactly right.
So tell us a little bit about the events and the educational seminars that you offer.
Sure. Well, I mean, just recently we started to get out into the boroughs because we had been doing things in Manhattan, and so we recently had an event in Queens, and actually Susan was there to talk about e-care diary, but we really did also discuss healthcare reform and how it impacts caregivers. And that's really looking at the future, because the country knows that there's going to be more and more caregivers in this role, and how are we going to help caregivers in a cost-effective way, but one that really proves to do well. So part of healthcare reform is looking at research and evidence-based practices that will be implemented in communities.
And there's so little, I mean, I think the average person really doesn't fully grasp, the issues of healthcare reform. So these are the things that you bring to the forefront.
That's right.
To help,
and even organizations, I mean,
Yeah.
professionals, there's just so much involved. Even
Yeah.
we have to understand it first so that we can pass it on. And so that's part of it, is having organizations come and start to break down some of the issues.
Fantastic. Great. Now, tell us about the future of caregiving in New York City. What do you see? I mean, there's a huge need, obviously.
Yeah. Well, I have to say, I actually recently came back from San Francisco from the National Conference on Aging, and there was so many things on caregiving, which just in and of itself tells you just how much of an issue it is and how much it is growing. And the voices of caregivers are being heard, but we really do need to continue to lend our voices so that the support that needs to be there will be there for caregivers. And as I said, I think evidence-based practice, research, and things like that is going to be a big thing. But how are we going to, it's costly, how are we going to implement that into the community so it becomes real for caregivers like yourselves?
Right, right. Well, that's fantastic. I'm so glad that you've joined us as the new co-chair.
I'm glad to be here.
Now I'd like to turn this over to Megan, and I'd love for you to tell us about the Caregiver program at SNAP, and tell us what SNAP stands for.
Sure. SNAP stands for Services Now for Adult Persons. And like Marie Ellen touched on, it's an agency that provides a whole host of services for seniors in the community. And part of that is the Caregiver program. So we provide assistance to anybody, providing unpaid assistance to a loved one 60 or over. A lot of times it's a spouse caring for a spouse, a child caring for a parent, so on and so forth.
Right. Now, who is considered a caregiver? And I think another part of this question is it also an issue of self-identification?
Absolutely. A lot of people are caring for somebody in their life because they love them, because they need to, because they want to. But they're not necessarily calling themselves a caregiver. So we have to do a lot of kind of education on people identifying themselves that way. Because again, you're probably helping somebody on a regular basis with any array of tasks, whether it be your parent, your spouse, your sibling, your neighbor, your friend. You might be living with them. You might be doing it from afar, and all of that's classified as being a caregiver.
Right. Guess what? You're a caregiver. You're taking care of any of those people that you just listed.
And I mean, the list goes on, but so.
Okay. Now, tell us a little more specifically about some of the program services.
Sure. So if you're somebody caring for a person 60 or over, all you have to do is call into the program, and you're able to access any of the services, including individual counseling, which can be done in person or over the phone. We have several different support groups running at different sites in Queens, and we also have a teleconference group for spouses every Friday.
That's wonderful.
Yeah, it really is, because it's very hard for some people to get out.
That's what I always get. I mean, we get emails and people are like, well, how do I get to these support groups?
Right.
I'm taking care of my mother and I can't leave her alone, so this is wonderful.
Right, and we hope to start up more too as the need presents itself. So that's a big one, the support groups, and we do monthly workshops on different topics related to caregiving, case assistance if you need help with entitlements and benefits, information, resources, referrals.
Like if you're trying to navigate, you know, the services out there that like senior care provider services. And
right. So maybe you need
Yeah.
a referral for an elder law attorney, or help with the Medicaid process, or you know,
well, that's
anything like that, really.
That's fantastic. I mean, that
because if we
one-on-one,
can't help,
yeah.
we connect you to who can is really the bottom line.
Great.
And then a big part of the program is respite, which
please talk about that, because I don't think many people understand what respite care is all about.
Sure. It's meant as a short-term break for the caregiver, a well-deserved break. And we can do that in two different ways. One is where we connect the person they're caring for to an adult day program in the community, where they can get out a couple days a week for a few hours, get some socialization, a bite to eat, you know, activities. Or we can send a home health aide into the home on average 8 hours a month for, say, 3 months at a time. We do that so we can constantly be giving people a chance. We kind of rotate people.
Is this free?
Yes, our
Wow.
services are free. We get our funding through the Department for the Aging. It's federal funds that come down through the state and then to the city and passed out to the community agencies to provide the services. So the respite's totally free. Like I said, we give as many hours as we can. We just make sure that everybody gets a chance.
Right.
So.
And do you have a lot of caregivers taking advantage of this?
Yeah, we do. We do. Most people want the respite. What's nice about our program is it combines the supportive element, where they can join a support group or get some individual supportive counseling, but something concrete like respite is you know, a big part of the equation too.
Right.
So they can get out, get to the doctor, get their hair done, visit with a friend, and kind of, you know, rejuvenate,
Yeah.
you know, a little bit for themselves.
You know, before we go any further, I want to remind the audience that if you want information about this respite care program and any of the caregiver programs at SNAP, the website you can visit is www.snapqueens.org. And going back to the New York City Family Caregiver Coalition, where can...
Well, they can contact Council of Senior Centers and Services, or they could call, actually, even me directly.
Great.
At 718-454-2100, and I'd be glad to help them.
Great. This is phenomenal. I also want to talk a little bit about you know, what your overall message is to caregivers. You know, I realize, you know, these are services available in New York City. We are a national website, and I know that many of you watching out there are from all over the country. But I think what I'd like to add in here is that you should really look for these type of resources in your local community. They do exist. The federal government is certainly providing funds to support caregivers, because it's becoming an increasingly growing and recognized issue amongst those who care for elders in this country. So please do take advantage of these services. What is your message to caregivers?
Well, when I go out into the community, I like to just tell people that, you know, they're not alone as caregivers, and that there is help out there, and that you shouldn't feel badly asking for it. You know, caregiving is a mixed bag of emotions, and that's okay. So.
And I was going to add that also, that looking for support doesn't have to be an overwhelming task. There are people out there even to help you figure out what you need. And like Megan said, you know, asking for help is a strength. It's not a weakness. And we applaud you for what you're doing.
Thank you, and thank you for that message. I think all of our caregivers out there need to know that. Thank you for joining us today. Tune in next Friday at 2 o'clock live.